Creutzfeldt-Jakob and new variant Creutzfeldt-Jakob disease. Creutzfeldt. Creutzfeldt-Jakob Jakob. Creutzfeldt-Jakob and new variant Creutzfeldt-Jakob disease. Creutzfeldt-Jakob disease, also called CJD, and new variant Creutzfeldt-Jakob disease, NVCJD. This CJD will be in capital letter. Disease belong to a group of degenerative infectious neurologic disorders called transmissible spongiform encephalopathies, TSE. Transmissible spongiform encephalopathies. Although CJD and NVCJD have distinct clinical and histologic differences, they have many features in common. Both are rare and have incubation periods ranging from months to decades. In both, the symptoms are progressive, there is no definitive treatment, and the outcome is fatal. CJD occurs primarily in adults aged 50 to 70. The incidence of disease is 1 per million worldwide. The NVCJD occurs in younger patients and has a prolonged duration of illness compared to CJD. Pathophysiology. Although still debated, the causative agent appears to be a prion, 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 a proteinaceous infectious particle smaller than a virus. The prion converts a normal cellular protein to an abnormal form, thus destroying neurons and glial cells. The grey matter takes an spongy appearance, that is, spongiform changes. Lesions or plaques also appear in various locations in the CNS. In CJD, the method of transmission is frequently unknown. However, direct transmission by contact with an infected animal of the prion to humans may initiate the degenerative neurologic process. The disease is also heritable, and familial groups account for approximately 50% of cases. Clustering in certain parts of the world. Iatrogenic transmission accounts for approximately 5% of cases and is due to contaminated neurosurgical devices and blood transfusions and the use of cadaver-derived growth hormone. Growth hormone is now created synthetically. Previously, cadaver-derived growth hormone also a cause. Clinical manifestations. Many patients with CJD have vague prodromal syndrome symptoms prior to specific neurologic changes. Symptoms usually include behavioral changes, dementia, mutism, visual changes, cerebellar, pyramidal and extrapyramidal signs, and myoclonic jerks. The myoclonic jerks may be spontaneous or precipitated by auditory or tactile stimuli. The myoclonus spasms may involve a single muscle group, a limb, or the entire body. The symptoms progress until the patient is completely unaware of the environment and immobilized. Although the same type of agent, a prion, causes NVCJD, there are distinct differences in the clinical manifestations of NVCJD and CJD. In NVCJD, there are more prion-reactive plaques referred to as florid plaques surrounding spongiform tissue throughout the cerebrum and cerebellum. The characteristic EEE changes present in CJD are absent in NVCJD. Anxiety, depression, and behavioral changes are the initial symptoms of NVCJD. Cerebellar symptoms occur with gait changes and ataxia. Myoclonus is present in most patients diagnosed with the NVCJD. Memory and cognitive impairments occur late in the course of NVCJD. Mutism occurs in both NVCJD and CJD. Assessment and diagnostic findings. Historically, sharp waves and spikes on the EEG were the only features available to support the diagnosis of CJD. Recent detection of the polyclonal antibody in CSF has enabled the diagnosis of CJD. In addition to the presence of polyclonal antibody in CSF, a protein increase is demonstrated along with the presence of enzymes indicative of neuronal loss. CT scan is used to rule out disorders that may mimic the symptoms of CJD. MRI scans are useful identifying lesions in the basal ganglia in most cases of CJD. Definitive diagnosis is made by brain biopsy or an autopsy. Medical management. After the onset of specific neurologic symptoms, progression of disease occurs quickly. There is no effective treatment for CJD or NVCJD. The care of the patient is supportive and palliative. Goals of care include prevention of injury related to immobility and dementia, promotion of the patient comfort, and provision of support and education for the family. The duration of disease is 4 to 5 months in CJD and 16 months in NVCJD, with death occurring as a result of respiratory failure or sepsis. Nursing management. As a medical management, the nursing care of patients primarily supportive and palliative. The psychological and emotional support of patients and families throughout the course of the illness is needed. This care extends to providing for a dignified death and supporting the family through the process of grief and loss. Hospice care should be used either at home or at an inpatient facility. Prevention of disease transmission is an important part of nursing care. Although patient isolation is not necessary, use of standard precautions is important. Institutional protocols are followed for blood and body fluid exposure and decontamination of equipment. Conventional methods of sterilization do not destroy the prion. The CDC guidelines, based on WHO guidelines, outline the stringent sterilization methods that must be used to destroy the prion on surface. Thank you.